Good morning everyone and welcome once again to Wacky Wednesday. Today, as you can see, we have a beautiful guest here with us. Yes, she is Radhika Harlaka, a counseling psychologist. She has her own private practice and believes in teaching people how to be at peace with their thoughts and emotions. What a beautiful thought it is, isn't it? So over to Radhika Harlaka. Both Radhika and me are expat women. Both of us are Indians and both of us are here in Singapore. So we are passionate about women's issues, especially those that tackle the expat women, whichever country they come from. Right, Radhika?
Absolutely.
And there's one particular issue regarding women which has not got the focus it should get. Yes, dear friends, this issue is the postpartum depression, PPD. And I would like to ask Radhika, Radhika, what do you think is postpartum depression? What are the signs and symptoms, and how would anybody differentiate postpartum depression from normal baby blues?
Okay. So with postpartum depression, this is it's a much more serious condition than baby blues. So to say, it can occur any time within 1 year of giving birth
Yes.
to a child.
Yes.
But it's also important to remember that it can happen during pregnancy as well.
Yes.
It
Yes.
can happen with a miscarriage as well.
Yes.
And
Yes.
with baby blues, Dr. Priya, what happens is baby blues tend to go away after 2 or 3 weeks,
Yes.
after giving birth. But with postpartum depression, it's much more serious than that.
And how? What are the telltale signs of
Right.
postpartum depression?
So there are two very important signs that you need to look out for. One is loss of interest and pleasure in things that you used to enjoy.
Absolutely.
And secondly, it's a low mood, persistent low mood.
Yes.
When you're feeling sad all the time,
Yes.
maybe you're crying
Yes.
a lot,
Yes.
and they last for many, many days and weeks.
Does it change anything to do with your appetite and your sleep?
Right. So, along with these two very important signs, there are other signs and symptoms which will tell you that, maybe you're suffering from PPD. Your appetite changes.
Yes.
You can have a very, very low appetite, you don't feel like eating anything.
Yes. Yes.
Or, the craving might be so much, and this is much more and beyond than eating enough for you and your baby,
Yes.
more than these confinement foods that we're
Yes.
used to.
Yes.
And with sleep changes,
Yes.
just not getting enough sleep,
Yes.
or with some people just feeling like sleeping constantly.
Yes. Yes. So, since she brought out these points, I would like to ask my audience to just delete a little bit of the traditional overlay, because you see, in most traditional communities, a woman is told to eat more and continuously fed by either the confinement nanny or the confinement cook or her mother or mother-in-law or grandmother-in-law, whoever is there, because traditional communities believe that a woman has to eat for herself and her baby, and so she just complies. But in this, eating more is, it's an internal urge, and you have to know to differentiate that.
Yes.
As well as sleeping more or less. Of course, your sleep is going to be less because you have to feed the baby, but here there is, even when you lie down, you just don't get sleep.
Yes.
And sleeping more is really sleeping more. Normally, a new mother is very vigilant to the needs of a baby, and if the baby cries, either because the nappy is wet or he needs a feed, she wakes up. But this is like she's just oblivious to the needs of the baby, right? Again, what do you think, Radhika, then would be the causes for PPD?
Right. The causes for PPD, again, and we'll see this in the signs and symptoms as well, they are hormonal
Yeah.
and biological,
Yes.
because there are so many changes occurring in the body,
Yes.
during pregnancy, after birth.
Yes, absolutely.
And just not a birth, but sometimes there's illnesses
Yes.
and hospitalizations even after the birth.
Yes.
There's trauma,
Yes,
because of
absolutely.
birth.
And what about the psychosocial causes
Right.
surrounding postpartum depression?
Yeah, those are so important as well. The
So
psychological.
she is a
and the
psychologist.
social
I
causes.
thought she should really focus
Yeah.
on that.
Again, with the signs and symptoms, you'll also see some of them are just feeling overwhelmed,
Yes.
all the time, because there is such a change in the role,
Yes.
and especially we as women, we work, we
Yes.
take care of the home,
Yes.
and now we have a new baby to take care of as well.
Yes.
And we want to do all things perfectly.
Yes.
We want to be super women,
Yes.
So that can be extremely stressful right in the
Yes.
beginning. Returning to work after maternity leave
Yes.
can be tough,
Yes.
when we're trying to juggle all these things.
Absolutely.
And there is such a lack of support now in
Yes.
modern society.
I agree with that completely.
We used to say that it takes a village to raise a child,
Yes.
but now we don't really have so much support.
Yes. In traditional communities, be it India, China, wherever, you have the mother, the grandmother, the aunt, cousins, everybody rallies around a new mother to help her take care of herself and the baby. But then we leave everything that we know and move to a new country or new destination. Can you imagine how difficult it is? Sometimes the parents do fly down to help you take care, but that's about it. There's no extension of the family to help you take care of the new
Yes.
baby. So I always tell people, we all live in apartment blocks with the door closed. Our neighbor doesn't know what's happening in our home. So let's just open our door and welcome our neighbors into our lives in our homes so that we can be each other's support system. Radhika had brought out the point of biology, and I agree with her. Biology matters a lot. You understand, the uterus was up here, and now it has suddenly descended. And if you have had a C-section, the C-section scar, which takes almost 6 months to heal internally, is still there. The episiotomy, if you have been given during natural birth, sometimes doesn't allow women to sit. And then there are those postpartum piles. It's a pain to feed the baby because the piles and fissures are hurting. And a lot of women, Radhika, these days use what is known as the epidural pump. Even that hurts. So there are so many changes, not to mention the hormones.
Right.
And I think Radhika would agree, hormones play a major role in PPD. The estrogen progesterone, which suddenly change after the birth of a baby, throw the woman's system absolutely in a whack. It's like a whiplash phenomena, and she has to cope with all that, right? So postpartum depression is a reality, and I would like Radhika to share, what do you think is the prevalence of postpartum depression?
Oh, it's so high. About 1 in 7 mothers will experience postpartum
That's
depression.
really, really
1 in 10 fathers also do it.
Yes.
So let's not forget about them.
Fathers, yes. And I'm so glad she brought this point, because giving birth to a baby, yes, the woman has given birth, but the man, her husband or her partner, has also been going through a lot of changes in his life, and I'm glad she brought it up. Yes, fathers do suffer from postpartum depression. So then, Radhika, what should a woman do if she feels that she's having postpartum depression?
I think firstly it's so important to know that you're not alone. There are many other women suffering and going through the same thing. So it's important to talk to people about what you're going through, talking to other mothers about
Yes.
what you're going through, and you'll find that there are so many other people who go through the same thing. Secondly, know that you are not to blame.
Yes. Don't
Okay.
feel guilty. It's not
Yeah.
something that you have brought upon yourself.
Right. And this guilt is a very important point, Dr. Priya, because it's, the signs and symptoms of depression can also mean that you suddenly start feeling so guilty all the time,
Yes.
so overwhelmed,
Yes.
so exhausted and tired,
Yes.
much more than normal.
Yes.
And, sometimes there's a feeling of worthlessness that I'm not a good enough mother.
Yes. And that usually happens with the first time mother for a firstborn.
Yes.
Maybe in the second, third, it decreases slightly because you are kind of a pro in managing kids. But for a first mother, first time, firstborn, yes. But like she said, you have to reach out.
Yes.
And not just to other mothers, friends and family, but also to medical professionals. You do need counseling, and do look out for an empathetic counselor like Radhika or anyone else in your vicinity. You need counselors. You need health practitioners. Remember the hormonal and biological overlay? So you do need medication. Yes. And I understand that most of you are breastfeeding, so you can't take chemical medications to when you're breastfeeding your baby. But then there are traditional therapies like traditional Chinese medicine, like Ayurveda, like homeopathy. In homeopathy, we have great medicines for postpartum depression. Not only that, we have medicines for these things that add up to postpartum depression, like mastitis, which can be very painful, like fissures, which happen after birth, like pain in the scars either of episiotomy or cervical C-section, and even for the little baby who sometimes gets all colicky, all sleepless, and troubles the mother. Yes, and adds to a depression. So that, then there are aromatherapy blends which can be used to calm the mind. Yes, so it's a more holistic approach that even altering your diet, keeping in tandem, of course, with your traditional confinement food, but there can be a lot of alterations. And yes, don't forget your supplements. You know, Radhika, most women, when they are pregnant, they will have their supplements very regularly because they want a strong baby, like vitamin D and calcium. But the moment the baby is born, they forget about themselves.
And that adds to everything.
Absolutely.
Because taking care of the mother, of your own self,
Yes.
rather than just focusing on the baby,
Yes.
is so important.
Yes.
Proper rest, nutrition,
Yes.
exercise,
Exercise.
and
Yes.
having me time
Yes.
away from the baby.
Yes. So, dear friends, if you have a friend who has just delivered, don't wait for her to reach out. You reach out to her. Walk into her home and say, do you want me to help you take care of the baby? Let her sleep while you take care of the baby. Right?
Absolutely.
Maybe cook something for her and take it so that she can eat and doesn't have to spend time in the kitchen. Yes, they do need you. And if you are a new time mom, pick up your phone and call your friends, ask for help. It's not wrong, right? On that point, I would also like to add, in India, we have confinement massages, and so too in the Malay and the Chinese community. Do get a massage. You need it for your body, and after a massage, do get your beauty sleep. It's absolutely essential.
Yes.
And the vitamin D. You see, you have to take your newborn baby outside for the UV light. Step out with the baby. Go for a walk. The fresh air, the fresh sunlight helps to elevate your mood. And together, as psychologists, as alternative health therapists, as friends, as families, let's not say, shoo it away, oh, this happens to everybody. No, let's reach out and together let's raise happy, healthy, harmonious kids for a happy, healthy future. On that point, dear friends, I would love to thank Radhika for spending her valuable time with us and giving us so many beautiful insights into PPD. Thank you, dear Radhika. Thank you from the bottom of my heart.
Thank you for having me, Dr. Priya.
Thank you, everyone. And let's together help